Coronavirus. Everyone has been asking the same question. I know I have. How bad is the pandemic going to be?
Tom Hanks and his wife both
flight out. There's a bigger plane that could fit everybody.
Americans should know that this is a potentially very serious public health threat.
Elisa Docor is going into Miss Toro's room, and then she's connecting with Miss Toro's family so that they can actually see their loved one. There's a part of her that knows the likely outcome of the testing.
As defined by the World Health Organization, coronavirus disease or COVID-19 is an infectious disease caused by a newly discovered coronavirus. This pandemic has impacted all aspects of our lives, including education and the economy. Governments have issued stay-at-home orders, and as a result, colleges and universities have been shut down across the world.
Globally, as of 16 May 2021, there have been 162,177,376 confirmed cases of COVID-19, including 3,364,178 deaths reported to WHO. As of 12 May 2021, a total of 1,264,164,553 vaccine doses have been administered. As a student, I will respond to this phenomenon through protecting myself and others around me, knowing the facts and taking appropriate precautions, and following the advice provided by the local health authority. To prevent the spread of COVID-19, we should always follow the protocols.
I believe that mass vaccination is the only way to solve this issue. This kind of operation would have a significant effect to the battle against the coronavirus. This message is addressed not only to the world leaders, but also to everyone all over the world. We won't be able to fix this crisis until we work with the government. We must still adhere to the safety precautions in order to protect not just ourselves, but also those around us from the virus.
Coronavirus affects children, teenagers, and adults alike. We're all dealing with this issue without even understanding it. It has been a year since this virus spread across the globe. Suffering for a year is enough. It is time to start making progress and end this pandemic. We all know that you are doing the best that you can to keep everyone safe from the virus and to prevent this virus from spreading. And we thank you for that. Your service is much appreciated, and we hope that you continue to do so in the coming years. And lastly, we also hope that you keep yourself safe as well.
We as students, our advocacy is to raise awareness about our current situation. We all want to end this crisis, and we've collected a list of actions that everyone can take to join the battle against disinformation and prejudice, as well as to encourage community support and spirit, split by the amount of time it will take you to be involved, so you can determine how you can best participate. By that, we seriously need to follow health protocols. We should help our frontliners by staying at home to reduce the spread of the virus. Let us not risk ourselves. Help each other and support each other.
As we all know, that PhilHealth plays a vital role in the Philippines' health agenda and is funded by direct and indirect paying members. Officials of the embattled Philippine Health Institution Corporation have stolen some 15 billion from the agency using different fraudulent schemes. Lawmakers and other health advocates in the country see digitalization as a solution to speed up the corporation's processes, particularly on reimbursements, but also in reducing fraudulent activities that plague the corporation. Digitalization, they believe, will aid in data transparency and will allow for easier tracking of the corporation's funding. Ensuring data transparency will be critical in the rollout of the law, which PhilHealth initially said would be fully implemented in the mid-2021. The pandemic could affect the timeline, however.
We all know world leaders already utilize the most possible ways to address this problem. But one important aspect is to integrate pandemic preparedness into national emergency preparedness frameworks. We recommend to all global leaders that are armed with a robust national and global strategy, more effective organizations, and adequate funding. International partners should be better positioned to implement the essential elements of pandemic preparedness and to execute quickly and effectively when the next pandemic erupts.
They should develop national surveillance systems to collect up-to-date clinical, virological, and epidemiological information on trends in human infections with seasonal influenza virus, which will also help to estimate the additional needs during a pandemic. Detect animal and human infections with animal influenza viruses, identify potential animal sources of human infections, assess the risk of transmission to humans, and communicate this information to WHO and relevant partners. The pandemic is here, and the vaccine is the only escape. However, it is still too complicated and we need to cope. We must observe proper social distancing, wear our masks, and always sanitize our hands and clean our bodies. The statistical data of deaths aren't just mere numbers. They are real people with families. It is a great loss, and we can't afford losing any more lives. Prevention is always better.
Identify priorities and response strategies for public and private healthcare systems for triage, surge capacity, and human and material resource management. Review and update continuity of healthcare provision strategies at national and sub-national levels. Update leadership and other relevant sectors regarding global and national pandemic influenza risk status.
COVID-19 pandemic is not over. The only thing that is certain is that when this virus is vanquished, another one will take its place. And this advocacy is intended to ensure that in future waves of COVID-19 pandemic, and when the next one occurs, the world is better prepared to avoid at least some of the missteps that have cost humanity so dearly. And to do that, let us help each other in our own way possible. As Kiran Mazumdar Shah said, ultimately the greatest lesson that COVID-19 pandemic can teach humanity is that we are all in this together.